as well. Wash this bag with oxygen. Watch to see whether it deflates. So in this case it deflates, it's got a leak. This will require checking. So pop a drape. Small kits, if it was a small dog or if it was a large dog, you run a large kit. Gloves, general size scalpel blade. We have suture material here. Over here is where we keep our extra suture material. So we have also our other suture material, which include the needles. There's 4 different sizes, types, all in those 3 drawers. Okay, over down here is where we keep our cauterizer. So we have our cauterizer here, which you would require for like lump removals or just in general. It's always best to keep it, not where it is, in case of it asks for it. Okay, and then that will live up here and get plugged in ready for surgery. In here is where we keep our wet kit. So our wet kit has some sterile instruments, drains, needles, and it also contains our staples for an emergency stitch up that could be stapled together depending if the vet requires it. Okay. Some non-routine or emergency surgeries require extra equipment such as suction, diathermy, and fluid pumps and bags. The clinic I work at has not had to use any of these since I have been there, during the time I've been there. In our clinic, we have pre-sterilised kits, both for small animal surgeries and large animal surgeries, between 4 and 6 of each kit. These kits contain instruments necessary for a basic spay, castrate, lump removal, etc. Non-routine instruments such as orthopedic instruments, wet kits, oral hematoma equipment are all kept separate and are also pre-sterilised if required. Non-routine instruments may include orthopedic drills, rasps, chisels, etc. required for surgery such as cruciate ligament repairment, oral hematomas, emergency stitch-ups, etc. Steps to checking anaesthetic equipment functions include ensuring isoflurane/inhalation agent is full, and if not, you must refill it. Check soda lime for discoloration. This would indicate that the soda lime requires replacing if fully discoloured. Soda lime is used to absorb carbon dioxide. Discoloration indicates that the sodium line cannot absorb any more carbon dioxide, therefore must refill. Ensure the oxygen cylinder is not empty and does not have any leaks. Replace if too low to perform surgery. Check flow meter is working correctly, and locate emergency oxygen button and check to see if it is working order. To set up a semi-closed and closed rebreathing circuit, 1. Connect the Y-piece tube to the inhalation and exhalation valves, or connect the F circuit to the valves with the other shorter tube to the exhalation valve. So connect the F circuit to the valves with the main stem tubing connecting to the inhalation valve and the shorter tubing connecting to the exhalation valve. This will depend on whether you have a Y circuit or an F circuit. Connect the black tube to the gas outlet connection point and ensure it is screwed on correctly. And then lastly, connect the oxygen/scavenger hose to the rebreathing unit. To perform a leak test on a rebreathing circuit, cover the end of the tube, close pop-off valve, flush oxygen into the bag, watch the manometer to ensure the system is holding pressure, open valves and squeeze the bag to finish, so then the excess oxygen is flushed out through the scavenger hose. Staff preparation includes gowning, scrubbing up routines, and discussing the roles and theatre rules, such as the location of sterile areas, who's going to be scrubbed in nurses, who's monitoring the patient, who's in charge of the anaesthetic, etc. Regular checks and equipment maintenance includes and is not limited to the following. Check clipper blades for bluntness. After each surgery, clean clippers using a brush to remove the hair and spray with clipper oil. Check soda lime, check isoflurane, check oxygen cylinders and oxygen flush buttons, check anaesthetic units for leakages, ensure all equipment such as needles, scissors, blades, etc. are all sharp. If blunt, replace, making sure you dispose of into a sharps container if requiring disposal. Ensure kits are cleaned thoroughly and correctly sterilising. Re-sterilise kits if they have been left unused for a period of 3 months. Leak tests on a non-rebreathing circuit steps include: occlude/cover the end of the main hose that would connect to your patient. Fill your bag with oxygen. Watch for any leakages in the bag. Moving the patient to the theatre can either be done by walking them in or carrying them in. If lifting, make sure you use proper lifting technique. This involves lifting from the knees with a straight back. Use correct restraint and handling techniques for each patient depending on their species, their temperament, etc. To set up a non-rebreathing circuit, connect common gas line or the smallest tube to the gas line outlet, and then connect up the scavenger hose or the corrugated tube to the anaesthetic machine. Positioning aids are used to position a patient during surgery. You can make use of the plastic or wooden V's depending on what your clinic has, ropes/ties, or you can just use your surgical table. So at our clinic, our surgical table can be adjusted into a V itself. This is often used for really large animals that are like 40 kilos, 30 plus, stuff like that. And site preparation technique. So step 1, you're going to clip the skin/surgical site. Then you're going to spray with dilute iodine and wipe down with swabs. Repeat till clean, and then repeat 3 more times using the in and out technique. So you're starting from where the surgical site would be outwards. Only using one swab at a time and repeating till everything's gone. You're going to repeat that 3 times. Then you're going to spray with the pink spray. So our pink spray is mix of metho, water and Chlorhex. You're going to wipe off using the in and out method and repeat this 3 times. And then lastly, you'll spray with iodine, wipe up as above, or like as previously. Repeat this 2 times, leaving the third on. And that is all.